You must have noticed some major changes in medicine in your long career.
Oh yeah, from the 1950s to the 1950s to 60s there was very little change. But from the 1970s it started to gather speed, and the county hospitals were developed better. They were enlarged, and the old sweep hospitals who did very well for the time, 1930s and 40s, 50s, they were enlarged greatly. The staffing was increased, the training was better. In the county hospitals it was equal to or better than the teaching hospitals, and eventually the county hospitals became officially recognised as extension of the university training of the nearby university, Galway, Cork or Dublin. The attitude of the students changed, but I don't think it changed for the better. In the early days, the students were motivated towards medicine as a vocation, and it seemed to change about the mid-80s, coming on to the late 80s, that it was now a very desirous occupation which they had rightfully earned by getting high marks in the leaving. It seemed to be regarded as part of the victory of getting 3 A's and 2 B's, or 4 A's and 2 B's. It was another notch on the victory stick. And it was quite rapid from the early 80s to the early 90s, this change. They were more impatient of bedside teaching. They wanted to be taught how to do well in a written exam, how to get honours. At times I had to say to students, you know, remember, you're not doing the leaving again. This is quite different. They weren't as inclined to listen or to spend the time at the bedside learning by listening, observing. They wanted action. They wanted to be told how to do well in the exam, where to go to get this, the key on doing well in the exam. And
would it be true to say that the doctor and the training became more important than the patient?
I agree with you, yes.
I've often thought that.
Yes.
When we've closed down hospitals, they were coping quite well.
That's
they were given a service.
That's right.
And for some strange reason, people ran them down deliberately.
Absolutely right.
I often thought that.
Yes.
That the patient became very secondary.
Yes.
The doctor, the training became one.
That's right.
And the patient can queue as long as he likes.
That's right.
Yeah. And in terms of medication and procedures, what were the big changes you've seen?
Well, in the big changes were the various ways you could confirm your diagnosis. I mean, those changes were enormous since 1950, 60, 70, and 90 to 2011, 2012. There are enormous changes in the radiology department, particularly. They now, when the patients came, as I said originally in Castlebar, needn't bother doctor, I just wanted a certificate to go to Dublin for an X-ray. Now the MRI has taken the part of what they wanted of an X-ray in 1960, 1950. The MRI is essential in most diagnoses now.
Produces a great image. It produces it.
And the CT scan is equal and varying in its justification. But also, protective medicine has become to the fore. Most doctors are now conscious of the need to protect themselves against litigation. And I used to tell the junior doctors lately, before I retired, if they're going to practice medicine as a GP or hospital medicine other than in a secluded investigative laboratory, or even then they may not be safe, at least twice in their career they're going to be sued or threatened with being sued. And even the greater threat is they have a chance of being reported to the medical council
And struck off.
and have to defend themselves or be struck off.
What's the best drug you've seen come on the market in your time?
Aspirin.
Aspirin.
It was invented about 115, 20 years ago by a Jew who was subsequently arrested and to be deported to one of the camps. And the Germans noticed that he had produced this chemical that relieved pain, particularly certain types of pain, miraculously. And it was came from a tree. So they spared him and gave him his own quarters in a selected area where he was guarded, and then published that his assistant, who was not a Jew, invented it, and his name then was attached to aspirin. But for what it did, aspirin was the drug of the century. And now it has been shown to protect against heart attacks, protect against strokes, and it's even been shown to reduce the frequency or the incidence of certain types of carcinoma, notably the bowel.
That's right.
So it's for that little tablet, it's an amazing drug.
What's the best drug for gout?
I still think colchicine is the best.